Hey guys, it's Dr. Kurtz again, and we're going to do our second dinner with the doc. In this series, we're going to be talking about wellness, but again, vaccines, which I think a lot of people always have questions about vaccines. It gets a little complicated because kind of vaccines are different for everybody, but that's what we're going to talk about tonight. And so kind of the same thing as before. My dog's whining. Same thing as before. You can always check out our website. We're going to have more information on there, which will be some more supplemental things. We'll have a blog post up that goes a little bit more into detail about vaccines, but we'll also have some supplemental stuff there. And I'm going to talk about the health packages a little bit more towards the end of the talk, but you'll see that on there, and you're going to learn more about that stuff. And then once again, anyone who comments or likes this or RSVPs to the event gets entered into a drawing, and then this time it'll be a free phone call. So that's exciting. So let's just jump in. So vaccines are something that's really important to all horse owners, no matter what your horse does. If they're a backyard, horse, or if they're going out and showing a lot, and so they really are important for improving your horse's longevity and their overall health. The thing that gets a little bit tricky about vaccines is there's no standard vaccine protocol. And so basically we come up with the vaccine protocol for your herd based on several things. So one is risk of disease. So that includes for a lot of horses their age, their exposure to some sort of virus or bacteria, those sorts of things, and then also their geographic location. So the concerns down in Southeast U.S. are different from the West or the Northeast. So that's what we take into account, all those things. Another really big thing that we take into account is the consequence of the disease. So how easily horses become infected with one of the things that we vaccinate against, or how fatal that disease is. We also really consider the effectiveness of vaccines that we use. There's always the potential for vaccine side effects or reactions, and then we also really factor in the cost of the disease versus the cost of the vaccine. Now, it's also really important to remember that vaccine alone does not prevent disease. And so what I mean by that is that no vaccine is 100%. A lot of the vaccines that we use, we're actually using them to decrease the clinical signs or severity of disease, that we're not preventing it. So that just comes into, good, disease control and those sorts of things too. And the other thing that I think a lot of people get confused by is that vaccines don't allow immediate protection. Usually it takes at least a couple weeks to develop enough immunity to be adequately protected. So that means that we don't typically vaccinate a horse, the day before the show. We try to vaccinate about 2 weeks before the show so we have enough immunity. The other really important factor is that almost all these vaccines, we do have to booster them to get appropriate immunity. And so typically when we're doing the initial series of the vaccines, we'll give the vaccine and then come back and booster in 4 to 6 weeks. And then the other thing that we have to also consider is that every horse in the population may not be protected to the same level with the vaccine or for the same amount of time. And again, that we may always have, there's always potential for vaccine reactions. I would say it's very important to try to follow the same schedule for all the horses in the herd, because when you do this, you limit, when you have a high immunity and everybody has a similar immunity in the herd to disease, that allows what we call herd immunity. So it's, it's a very helpful, and that's kind of the cornerstone of herd immunity. Now, when you talk about vaccines, the AAP, which is the American Association of Equine Practitioners, they base vaccines into 2 broad groups. So they call them core vaccines and then non-core vaccines. So the difference between that, so core vaccines, they're defined as vaccines that are needed to prevent disease that's prevalent. And so kind of the ones that make the core vaccine kind of into that heading. The big one is that, is there a potential danger to public health? And so, diseases like rabies that pose a significant risk to public health, that's something that, are you helping me? I guess so. This is Skipper. What is it? Get down. Anyways, and so the other thing is, are they required by law? Same thing for rabies. Is this a very highly infectious disease that lots of horses, when exposed to, get, or is this a very fatal disease? And basically, what happens with these core vaccines is the benefit outweighs the risk of the vaccine. And so typically these vaccines that we're talking about, all your encephalitises, so Eastern, Western, West Nile, tetanus, and rabies. Then the other group of vaccines are called the non-core vaccine. And so kind of the more layman's term of this are risk-based vaccines. So basically, we choose to do these vaccines after we do a risk-based analysis. So basically, we choose to do them based on regionally or a specific horse population. So say you have a young horse that's in training and that we're going to send them somewhere where they'll be intermingling with a bunch of other young horses from other places that they really have a high risk of disease, those sorts of things. So there's a bunch of these vaccines. And again, these are always vaccines that are kind of based on you know, your veterinarian looking at things and where you are and all those things. So examples of those: anthrax, botulism, strangles, influenza, herpes, EVA, Potomac horse fever, lepto, rotavirus, or snakebite. So tonight what I'm going to do is talk about some of the core vaccines in the Southeast U.S. or here. And so the big cornerstone of these vaccines kind of depends on the fact that we have a mosquito population year-round. And so basically what we're doing is we're vaccinating more aggressively against mosquito-borne illnesses. And so, you know, kind of the same thing as the deworming talk. There's a lot of different things here that, you know, always talk to your veterinarian before making decisions about protocols and things like that. So this is for a mature horse that's already had this set of primary series. It's not like a pregnant mare or a young foal or something like that. So that's who we're kind of talking about now. So we'll jump on in. So the big one, Eastern and Western equine encephalomyelitis, which is a big word. So I'm just going to probably call them WEE and triple E from here on out. So kind of as the name suggests, Eastern occurs in more Eastern U.S. and the Western occurs more in the Midwest and the West. There is another strain called the Venezuelan that occurs in Central and South America, but that hasn't been in the U.S. for something like 40 years. And so there's actually also some thought that the Eastern and Western that we're vaccinating with has some protection against the Venezuelan, which is good. So this is a virus transmitted through mosquitoes. And so the good news is this isn't usually transmitted from horse to horse or horse to person, so that's good. But the mortality is really high on this. So WEE, the mortality is about 50%, and then triple E, the mortality is about 90%. So that's really severe disease. And so what we usually, and we know that young horses are more susceptible to this. So with this vaccine, we typically vaccinate them every 6 months. A lot of times we use a combination vaccine that's called EWT that has tetanus in it as well, which then we'll move on to tetanus. So tetanus is caused by a bacterium called Clostridium tetani, and so that's found in the soil. This bacteria actually lives in the horse's gut and is passed in feces, but it's a really hardy bacteria, really strong, really resistant to a lot of things that kind of kill it. So it survives a long time in the soil. And the good news about tetanus, which a lot of people know about tetanus, but it's not spread. It's not a contagious disease. This doesn't spread from horse to horse. But what we do worry about is when it infects some sort of wound. So that's what, any cuts or lacerations, surgical incisions, and then the other one that people sometimes forget about, mares after they foal, or even foals with their umbilical cord, that we really worry about tetanus. Now there are two big broad types of tetanus vaccine. There's a toxoid and an antitoxin. And I would say most of the time we are vaccinating with the toxoid, and that's what's in our combo vax with EWT and stuff like that. The antitoxin is a special vaccine that's made for horses that have no previous vaccination, and that we have a really risk of exposure that we're worried about. And so that one's really pretty rare to use. So like I said, typically the tetanus vaccine that we use, it's contained within the EWT vaccine. Typically we treat with tetanus toxoid every 6 months to a year. If I do have a horse that has a cut or something that has me a little bit worried and it's been over 6 months, I'll go ahead and booster them with another tetanus toxoid at that time, just to make sure our immunity is high. And now the next one is West Nile virus. And so West Nile is the leading cause of encephalitis in horses. And so it's also another disease transmitted by mosquitoes. Again, so there's not really any evidence of horse-to-horse or horse-to-person, contact. The fatality rate of West Nile virus is about 30%. And the thing about West Nile is in 40% of the horses that survive, that they show signs for up to 6 months after disease, and neurological signs, which is, a long time. And so usually with West Nile, it kind of depends on where you're at and, the vaccine that you use, but we usually do those 1 to 2 times a year. And the last core vaccine we're going to talk about is rabies. And really the infection rate for horses with rabies is very low. However, obviously there's a significant public health risk. And so rabies is transmitted through an animal bite, and it's just an annual vaccine that we give for that. And so kind of what I'm going to go over next are those non-core vaccines. I gave you a whole big long list of the non-core vaccines that we have. I'm just going to talk about really the ones that our clinic utilizes based on, assessing the risk for the different diseases, and then, typically what our horse population needs. So the first one is strangles, and that's caused by another bacteria called Streptococcus equi. And really we see a lot in immune-compromised animals. So those are very young animals or geriatric horses. And so typically with this vaccine, we vaccinate animals with a high risk of exposure. And strangles, it's very contagious, and it's very easily spread by, the respiratory secretions, around horses or stalls or barns or even feeding equipment, those sorts of things. And so, like I said, we vaccinate animals with a high risk of exposure. So a lot of times, like very young horses that are going off to training, I do vaccinate them for strangles. And typically what we use is an intranasal vaccine given once a year. Now, the thing about this vaccine is, and probably strangles is one of the most notorious ones, it doesn't actually prevent strangles, but what it does is it decreases the clinical signs and the severity of disease if they do get strangles. And that's what some horses won't get it, but, they can still contract strangles. With the vaccine. So that's where, good housekeeping and, doing biosecurity and stuff like that's really important. And the next one is influenza. Now, influenza is another virus, and it's very highly contagious. And again, it's seen most often in young horses, usually 1 to 5 years old, or horses that come in frequent contact with other horses, that is kind of a different population. So these are horses being shown and those sorts of things. So typically what we do is we vaccinate every 6 months for influenza. And then the last one of those non-core vaccines is herpes, which herpes goes by a lot of different names. It's also known as rhinopneumonitis, rhino, EHV. And so typically with the vaccine that we use for herpes, we're vaccinating against the virus strains EHV1 or EHV4. And so EHV1 likes to live in the respiratory tract of young horses. And so typically it's a problem in horses in, training barns or something like, like racetracks or something like that. And the big problem that we see with EHV1 is that it causes abortions in pregnant mares, but it also can lead to neurological disease. And the thing that gets a little frustrating about herpes is that you can have asymptomatic carriers. So that's why it's important to have regular vaccination for that one if your horse is going to a lot of different places. So kind of what we're doing, and there's different protocols based on, if you have a pregnant mare, you're going to be vaccinating for herpes different than if you have a horse going to show. But typically we vaccinate every 6 months, and most horse showgrounds require vaccination for herpes every 6 months. So that's kind of all the core vaccines and the non-core vaccines that we do. And so kind of the way our clinic does it is that we typically vaccinate adult horses that are going to show. So they're not just, pastures, don't have any contact with horses or something like that. If they're going out and showing, we typically vaccinate 2 times a year for EWT, and also 2 times a year for flu and rhino. And then we vaccinate once a year for West Nile and rabies. And so what we also do, because I know there's a lot of concern about vaccine reactions in horses, and since I've been practicing, you see a variety of clinical signs, and it actually can change in each individual horses. I would say most horses do have a little bit of an spike in a temperature. They may have some muscle soreness where the vaccines are administered. They may be lethargic the next day. Those are kind of the common complaints, and those are just typical side effects of vaccines. You know, same thing as when people get vaccines, we have those. But we definitely can have more clinical signs and, you know, horses with issues with their vaccines. So what our practice does is we like to separate out the vaccines, and typically we give a vaccine and we wait 3 to 4 weeks, and then we'll give the next series of vaccine. And so this does equate for more farm calls, but we do see a decrease in the side effects from vaccines. And we do also have vaccines that, you know, are combination, so we can make one trip and do all those vaccines for your horse. So now I get to talk about health packages, which is exciting. And so we came up, this is a pretty new thing for our practice, that we're going to do health packages. And so as the name implies, it's not just vaccines, it's not just, you know, those sorts of things. It's kind of, we sat down and thought about what horses may need in a whole year, and then prepared a list for stuff to kind of include that. So basically these packages, they include farm calls, they include vaccines, they include fecals and deworming and dentals and blood work and commons and all those things. So there's a bunch of different things with them. We do have different levels of vaccines, so, and you can choose those levels based on you know, your horse's use. So we have a gold level, which is, you know, horse that is a, you know, performance horse, that is, you know, and it has all the different vaccines and dentals and stuff like that. We have a silver level, which is a horse that has maybe like a weekend warrior type that you go to shows in a certain season or something like that. And then we also have vaccine packages for individual you know, individual horses that never leave a pasture and don't have contact with horses that are leaving. So anyway, so we will post all that stuff on our website. That will include a blog post and other supplemental information. And also always keep checking out our website. Oh, and the big thing, I forgot the big thing about the vaccine packages. So the big thing with the vaccine packages is when you elect to do a package all at once, what we do is we're offering a discount up front if you decide to do that. So that can be a discount of up to 25%, which is exciting for your horse and for you. Anyway, so like I said, check out our website. If you have any questions, we'll get those answered. And thanks for joining me tonight.